All right, everybody, let's look at the group assignment that we're going to do for the electronic health records class. I've pulled up a sample one here. There's going to be four specific cases for you to choose from. What I'm showing you here is a fifth one just for your education purposes. So there will be randomly assigned groups to one of the cases, and you'll work together to work through this. But I wanted to go through this document really quick and to show you sort of what was going to be expected of you for the assignment and what to do. And so each specific group project, there's a few different scenarios. The one I've chosen to show you here is one for gestational diabetes. So to get started, we're going to go to our patient that's indicated. You'll all have a different patient. So I've clicked on that link, and here's that patient in EHR Go. And then we'll also need to open up a care process model. And I've got that right here. So this assignment is going to be using care process models. This is coming off of our last module we did in the course, where we talked about how we can surface not just knowledge, but wisdom to the clinicians, how we can use clinical decision support rules within the electronic health record to help automate some of these decisions that clinicians need to know. And we can especially automate decisions that follow a pretty strict workflow, very specific and verbose questions that need to be answered. And so what these care process models do, these are a set of instructions for clinicians of best practices based off research methodologies and outcomes. And so these give you a specific workflow that you can follow. And we're going to go through these manually. I'm going to show you how to do it. But the idea here is for you to realize that we could automate a lot of this stuff. And when the clinician is seeing the patient, for example, the system could be asking the clinician some of these questions to help automate and speed up what they're doing with the patient. So the care process models, like I said, they're research-based, evidence-based, and they start with some pretty good, background and history, why this is important, why we have taken the time to do the research and to look into this, because we want to improve, patient outcomes and patient care. And then they have some facts and figures here. So all this stuff is going to be really helpful and useful for you when you're doing the assignment, which we'll talk about in a minute for the videos and stuff. And the actual assignment is going to start here at the algorithm. So let me go back here and look at our Word document here. So we've got open the patient chart, we've got open the care process model, and now we're going to start diving into what we need to do. This one again is gestational diabetes. You'll have something different. Okay, so read your instructions here, but I'm just going to go through it rather quickly and at a high level here. And in addition to that, we get a few tidbits, and again, everybody's is going to be different, but we have a few items that are going to help us go through these decisions that we need to know. And there's 6 of these items here. And so let's go through that really quick. So we've got open the patient. Let's go launch it in the EHR. As we've been doing, we just start up this patient's chart. It's still loading. Okay, so we have Jennifer Sun. She's a 33-year-old female. Looks like she has an allergy to walnuts. And it says she's in her first trimester. Okay, so we know that she's 33, she's pregnant. There we go. So we're just trying to get a little quick understanding about her. So now we need to go look at the care process model. And we need to go through these decision points one at a time. Okay. So this only applies to pregnant patients. So we need to make sure she's pregnant, which we just did. We saw that she is. And then the second box here saying we're going to do a universal screening. All pregnant patients are going to be screened. And it says here we can go to page 4 for more details. So let's just scroll down here to page 4. It's saying here that we have a couple of ideas or choices here. We can do this universal screening where we can either give her 50 grams of glucose, or we can do the fasting thing here. Or we can, measure her Her serum after that. So we want to read these and follow. Here we go. Here's the fasting one. So let's look at this one here. So we want to give her the 50 grams of glucose solution. So we should go into our patient chart. We should go to the order. We should make an order, add a new order for a prescription. Pick a provider, doesn't matter. What was it called? See what comes up. I should go look at the actual name of it. Let's just assume it's this. Well, hang on. Was that the 50? Let's go back and look. I forgot already. It was... Here we go. Okay, so 50 grams of pure glucose. I think that's the one I selected. And then right here, 50 grams or whatever. So it's going to be up to you to fill these in appropriately for your case. We'll just say maybe she's doing it. So many choices. There we go. Oral. I was looking for oral. Then how often? It's just going to be once. And again, it's a matter of finding all the right options. Once. There we go. Okay. And then the status, we're going to set that as active. That should be enough to get it started. Okay. So we made the order. The prescription has been sent to the pharmacy. Okay. So let's go back and look here at our care process model. So we need to wait an hour, and then we need to go see what her blood glucose is. And so it looks like 130, 140. I think there might be actually some up here. Yeah, right here. Okay, so we're going to look. And so then here we go back and look at our Word document. We're saying, so she's 23 weeks pregnant. We ordered her glucose test, and the results from that test were 200 milligrams per deciliter. So if we go look over here, 200 milligrams per deciliter is going to be over here. So she's in the high category. So we can skip those steps. We're going to jump right down here. So she does have gestational diabetes mellitus. And now it's a matter of what do we do about it? This is saying here we can go to page 5 to look at more of the details here. So let's jump down to page 5, 4, 5. Here we go. So it's saying what we should do. Looks like a lot of it here is going to be education number 1. I'm talking about caloric intake, talking about exercise, carbohydrates, and then that she monitors her own blood glucose on a fairly regular basis. Yeah, so we're going to have to read this to fully understand it, but the gist is we want her to monitor her own blood glucose. And so if we go back and look at our Word document, we're saying this patient has never had to deal with gestational diabetes, so we want to get her to the education. That's that page we just saw, so you'll have to work through that and figure out what it means. And now we're saying it's a week later. The patient reports that when she tests her own blood glucose each day, a few times a day, it's averaging about 140. So let's go see where that fits in. 140 right here. Let's go back up and look at our flow chart. 140. So we're here on this question right here. Is her blood glucose controlled? And that's this B box right here. And so B is saying, let's see. So it looks like it is controlled, or no. It doesn't look like it necessarily is for her. And so we might want to get some sort of medication. Oh, right here, sorry. Yeah, so she's about 140. Yeah, so we're going to say that she's high. And so we're going to need to find some sort of medication for her. That's going to be here on page 6. And there's going to be criteria as to which medication would fit for her and what the proper dosage is. And again, there's some charts. And let's just say, I'm not saying this is the case, but we're just going to go pick one for her. Let's say she fits where do we look at? Just one sec. Just want to make sure I didn't miss that. Okay. Okay. So we could either do insulin or metformin. Okay, so let's just go do metformin. That looks a little bit simpler to do. So we're going to need to go add to the record an order for medication. Oops, let's go create a new one. Prescription, provider, medication, so metformin. And we'd have to go pick the right one based off the criteria in the document. Let's just pick one at random just to get through this. So again, just make sure you're choosing the right ones. I'm just trying to go through this quickly. I don't see any specific. Oh, here we go. Let's do 850 milligrams once a day. Okay, so let's do 850 milligrams. That should be like a daily. Let's see if I can just search. No. Oh, that's the route. So oral. Well, it's going to be once a day. Okay, let's set that as active. Okay, so we got the metformin prescribed. And then we should probably go be adding other things. For example, we now know that she has gestational diabetes mellitus, so we need to go add that to her problem list. Let's go see if she has, if that's a choice. Yeah. And then we got to figure out, is it diet controlled or insulin controlled or not controlled? We'll just say it is insulin controlled. Active. And we save that. So we're going to add that to her list. And then we can go add things if we wanted, like what's her blood glucose. I think that might be a choice in here. Probably should have looked first. It might not be in here. Okay, yeah, might not be right in here. So we would have to go find out where we can log her hemoglobin A1C. And then, what do we got here? Okay, so we need to continue on with our diagram here. Okay, so we ordered her medication, which was metformin. We need to decide how we want to continue with, monthly visits or what have you. And again, this is on page 7 with those details, and then page 8 for how do we handle after she's delivered the baby. And if we go back and look at our document, it's saying we prescribed our medication, and then at week 38, we see her. We're estimating that her baby's fetal weight is 4,700 grams. How do we recommend this baby be delivered? And if you go check out, again, our care process model, there are things in here that talk about birthing options if you do have gestational diabetes, and the number of weeks pregnant you are, and how heavy your child is. And so you would have to go through, read all these things to figure out what the appropriate answer for your patient would be. And so that's the idea here, is you're gonna read all the information here in this care process model. You're gonna follow all the decision points. You're gonna use information provided in this Word document to help you get you through that. And you're going to come up with the proper diagnosis, the proper entries into the electronic health record, and you're going to be able to provide some sort of advice to the patient. And the way we're going to submit this assignment to know it's over, since it's a group project, is we're going to end up doing a video. So a single video, and you can decide how you want to do it. You may want to do it where you just do what I did and you walked through it, which is simple. Or you may want to do something a little bit more fancy where you sort of simulate the patient in the room and the doctor talking, and someone records that, and then you can sort of see what the screen on the EHR is doing. But however you want to do it, and the whole video needs to be about 6 to 9 minutes. Each person on the team needs to talk a proportional amount of time, 2 or 3 minutes. Just need to make sure you're concise and clear. We don't want you reading from notes, so just sort of make it like a conversation. Make sure you're dressing professionally on your video. And then you can either create your video using Panopto, which is a tool that Canvas has, or YouTube, or Snagit, or whatever. But you need to be able to have a link to the video when you're done. Talking about here on the submission process, you need to have a link to your video. Right here, yeah. So you'll post a link, and then we're gonna have a discussion board set up. So you'll post the link to the discussion board, and all your classmates will be able to see it and watch your video. And everybody in the class needs to respond to each of these videos, provide some sort of comments, and ideally some constructive criticism on how they could do things better, or maybe what they missed, or what you liked about it. And so you have to do that for each group's submission, which shouldn't be too many, just 2 or 3 or 4, but each person has to do that. And so that's the idea. That's the overall view of what we're trying to do here. And if you have any more specific questions when you jump into it, please feel free just to give me an email.